Admiral, I've only got a short time left here, but it's still a big question. And we obviously know what we're doing is trying to save lives with these shutdowns. But as you can see with so many of the viral stories we saw over the weekend of that business owner in California, it's also shattering many lives. What do you say when you see those business owners struggling to survive and what they're going through, the sacrifice that they are seeing?
So I see it every day, even in my neighborhood with a restaurant in the basement of on the first floor of my apartment. What really breaks my heart is that I don't know of any data that says you need to shut down outdoor dining or outdoor bars. We really wanted to limit the indoor crowded places. So I think we need to do what's necessary to turn the pandemic, but not more. That's not evidence-based. That's going to be counterproductive.
Why are they doing it then? Why are they doing it? Why are they keep saying it's the science. That's why they're shutting down all of California. Why are they doing it?
No, the science does not say that, and all of us on the task force, Dr. Fauci, Birx, Redfield, Hahn, we also, Dr. Adams, the Surgeon General, is that we do, if you're in a surge place, need to limit indoor dining and indoor bars. You don't have to close schools. You don't have to close universities. You don't have to close your major industries. You do need to wear a mask. That's critically important when you're in public and can't physically distance. Very, very important. And we see that these measures, they can be counterproductive. People get mad and upset because the science don't support them. The science does support limiting indoor dining in bars, but even now, there are many restaurants that have taken tremendous, they've split the tables by 7 feet. There's plexiglass. I'd like to see a little more individual attention to these places that have invested a lot of money and are probably safer than people having a house party with 100 people there. So, it's time to nuance. This is not March or April. This is December. We know what the science says. We know that there are countermeasures that are effective. And whatever the expression is, throwing the baby out with the bathwater, I think we could be causing a lot more harm by overly restrictive recommendations that are not supported by the science. We're very clear.
Well, you see what they're doing in Los Angeles, Admiral. Sorry about that. But, Admiral, you see what they're doing in Los Angeles? You see what they're doing in California? Is the governor there wrong? Is the mayor of Los Angeles, are they wrong?
So what I'm saying is that the evidence clearly does not support limitations on things like outdoor dining, particularly that are spaced, outdoor bars. The evidence just isn't there. And remember, shutting down completely, particularly if you don't have evidence, can be counterproductive. We just saw this week data that said that drug overdose, cardiac arrest doubled during the shutdowns in April through June, doubled, 100% increase. We know that, children don't receive care, that heart attacks go unattended. So shutdowns do have consequences. Do what's necessary and evidence-based. We try to be very specific about that. But when you do more, it frustrates the population because it's not evidence-based, particularly when politicians violate their own rules. We have to be reasonable. We have to be fair. We have to be science-based.